Hello, welcome to my channel. Today we're doing questions and answers directly from RN Nclex examination, and the title of my video today is Alcohol and Substance Abuse. Please hit the like button, please subscribe, please share this video. My first question is, a teenager admitted after alcohol DUI involving crack cocaine. Client newly admitted to obtain accurate assessment data. What will the nurse action be? The correct answer: to obtain accurate assessment data on admission of an alcoholic substance abuse patient. Correct answer is, after obtaining client's permission, validate information with family members. Note: in substance abuse, client tends to minimize or they may deny substance abuse. So you have to validate the information with the family if they are present. The next question: what would be the nursing intervention for client admitted newly nurses diagnosis risk for injury related to alcohol withdrawal? What would be your nursing intervention for alcohol withdrawal? The correct answer is, provide client with a quiet room free from environmental stimuli. This client is in withdrawal, risk for injury. My next question is, ineffective denial is a nurse's diagnosis. Client relapsed into alcoholism. What is the priority intervention to address this problem of ineffective denial is your nursing diagnosis? The correct answer is, help the client to analyze the effect of substance abuse on life situation. My next question is directly from Nclex questions. Clients admitted for benzodiazepine dependence detox. This detox is fourth detox. The third detox was considered complicated. What would be the nurse's priority intervention at this time? The correct answer: the nurse should monitor the client closely and initiate seizure precaution because client will be high risk for seizures. Please note, is detox. The third one was complicated. This is the admission for the fourth detox. For patients with detox, monitor them for seizure precaution, high risk for seizures. My next question is, which intervention takes priority? Client experience Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome. The correct answer is, monitor parental vitamin B1. Monitor parental vitamin B1. Please note, this is caused by thiamine deficiency. Rutgers-Korsakoff syndrome is caused by thiamine deficiency, which results in poor intake of vitamin B1, poor absorption. So we will monitor parental vitamin B1. My next question is blood levels for intoxication in the States. What is the legal limit? The legal limit is 0.08. And if the blood supply is greater than 0.08, the client is considered intoxicated. Prior to nursing diagnosis, client experiencing withdrawal. Prior to nursing diagnosis, for client experiencing withdrawal will be, the correct answer is risk for injury. There will be elevated blood pressure, tachycardia, hallucination, seizures. For clients experiencing withdrawal, they are at risk for injury. My next question is, client with alcoholism diagnosed with alcoholic cardiomyopathy. What is your priority nursing diagnosis for alcoholic cardiomyopathy? The correct answer is altered perfusion related to effects of alcoholism as evidenced by decreased oxygen saturation. The next question is, what is your nursing diagnosis for client with withdrawal? And the correct answer for nursing diagnosis client with withdrawal is powerlessness over addiction. Powerlessness over addiction is the priority nursing diagnosis for clients with withdrawal. Priority nurses diagnosis for intoxication. What will that be for intoxication? The correct answer is nursing diagnosis risk for aspiration. Please note, there is depressed CNS, depressed central nervous system. Client is rendered unconscious. There's inflammation in the stomach, nausea, vomit, epigastric distress that leads to aspiration. So your priority nursing diagnosis for intoxication is risk for aspiration. This patient is risk for nausea and vomiting, epigastric distress, which leads to aspiration. What is your outcome for client experiencing clinical dependency? The correct answer for outcome for clients experiencing clinical dependency is outcome should be tailored to individual immediate needs and ability. The question is, what is your nursing outcome for clients experiencing clinical dependency? And your correct answer is the outcome should be tailored to individuals' immediate needs and ability. The next question, client admitted with alcohol withdrawal to substance abuse unit for detox. Nursing diagnosis, ineffective health maintenance. What is the long-term outcome of this diagnosis, ineffective health maintenance? The correct answer: client will exhibit reduced medical complication related to alcoholism within 6 months is your correct answer. My next question: what would be initial nursing approach? Nurse planning relapse prevention for client diagnosed with substance dependence. What would be your initial approach? Nurse planning relapse prevention for client diagnosed with substance dependence. The correct answer is present information simply, using easily understood terminology is the correct answer for initial approach for client with relapse, substance dependence. Our next question is, which of the following are parts of CAGE, C-A-G-E abbreviation? A questionnaire screening tool used to determine if individual abuses alcohol. Which of the following are parts of CAGE, abbreviation CAGE, questionnaire screening tool used to determine if individual abuses alcohol? C is for cut down. The C in CAGE assessment tool means cut down. A is annoyed. G is guilty. E is eye-opener, or having a drink in the mornings. That's your eye-opener. That's your E. The next question: client with history of alcoholism diagnosed with Wernicke-Korsakoff syndrome. Which symptom would the nurse assess? Correct answer: loss of short-term and long-term memory and use of confabulation. The treatment of this syndrome is alcohol abstinence and thiamine replacement. Excuse me, please. Client with history of alcohol abuse complain of extreme muscle pain, swelling, weakness of extremities, and reddish tinged urine. What lab values should the nurse assess? And the answer is elevating CPK, elevated creatinine phosphokinase, indicates if there is alcoholic myopathy. What are the street names for cocaine? And the correct answer is Snow, Coke, Blow, Root, Lady, Flake, Crack. These are the street names for cocaine: Snow, Coke, Blow, Lady, Flake, Crack. Next question: positive findings for cocaine. Nurse would assess what? For positive findings for cocaine, nurse would assess what? The correct answer: the results of the client's urine drug screen sent to the lab. Next question: which of the following clients seen at the ED should the nurse see first? Client with cocaine with chest pain, or client intoxicated with alcohol? Which of these two clients should the nurse see first? Cocaine abuser with chest pain or client intoxicated with alcohol? The correct answer is the client abusing cocaine with chest pain takes priority. Because of myocardial demand for oxygen and increased heart rate, nurse should prioritize chest pain. The next question. A client diagnosed with alcohol dependency states that his wife A client with alcohol dependency states his wife stocks his bar with gin. The nurse suspects codependency. Which characteristics indicative of problem would nurse expect wife to exhibit? Which characteristic indicative of a problem would nurse expect wife to exhibit? And the correct answer is the wife is a people pleaser and would do anything to gain approval of her husband. The next question is, a client diagnosed with alcoholism is complaining of alcohol, is complaining of decreased exercise tolerance. Decreased exercise tolerance, lower extremity edema, arrhythmias, dyspnea. Which nursing intervention will be appropriate? The correct answer is administer lanoxin, otherwise known as digoxin, and Lasix. These are the clinical findings of alcoholic cardiomyopathy, signs and symptoms of CHF, heart failure. Decreased exercise tolerance, lower extremity edema, arrhythmias, and dyspneas are the signs and symptoms. You would administer digoxin and Lasix. The next question. The nurse has given client information on alcohol recovery. Which statement indicates that learning has occurred? The correct answer, I realize that recovery is a lifelong process that comes about in steps, is the correct answer. The next question is, what are the reasons for success of 12-step programs such as AA? The correct answer, 12-step program breaks down denial in atmosphere of support. 2. AA 12-step programs give client a sense of community is the correct answer. Please hit the like button, please subscribe, please share this video. Thank you. Have a good day. Stay tuned to part 2 of alcohol and substance abuse.